next, we're going to have Mamawa Kemokai, who's a public health nurse practitioner. He's going to talk to us about the new normal. Mamawa.
Thank you so much for having me this evening. The rules for returning to normal. There are health and safety CDC guidelines for specific occupations. Most precautions are similar for all occupations. It is important for both employers and employees to follow their specific guidelines to prevent the spread of COVID-19. If you have to order food and your other household items online, or you can have them deliver them to your house, or you can pick them up on the curbside. When you do have to visit in person, go during hours when there are fewer people, say compared to morning and late times at night. Next slide, please. Follow CDC steps if you are sick. Notify your network if you are experiencing symptoms such as fever, cough, or shortness of breath. Next slide. Essential errands. Of course, we all have things that we have to do every day. Doctor visit. Use telemedicine if available, or communicate with your doctor or nurse by phone or email. Talk to your doctor about rescheduling procedures that are not urgently needed. For prescriptions, use drive-through windows, curbside services, mail orders, or other delivery services. Next, please. Banking. Of course, we need to get to that money. Bank online whenever possible. Use the drive-through ATM if available. And whenever you go out and you use the ATM, make sure that you use a hand sanitizer that is at least 60% alcohol. Next slide, please. And now we're gonna go to testing. Testing is a very important part of COVID-19, which goes to to catch those that already have it and make sure that you don't pass it on. There are two types of tests. We have the viral testing, which identifies if you are presently infected with COVID-19. The antibody test identifies whether you were previously infected with COVID-19. And when we talk about contact tracing is the process, next slide, please, of assessing widespread exposure. How is testing done? Like I said earlier, for the nasal swab, which is the viral testing, a special 6-inch cotton swab is inserted in the nasal cavity for approximately 15 seconds. It's repeated in the other nasal or nares for another 15 seconds, and it's sent to the lab, and the results is typically available within 2 to 4 days. Antibody testing, you have to go to a place where they can draw your blood, and they send it to test for the antibodies of COVID-19. And sometimes I can tell you if you know similar viruses such as the common cold, they are all in the same family. Testing, you can locate testing site by going to the CDC website. There's a lot of information on the CDC website. If you go and just enter in the search box and just ask for what you need. Next, please. Thank you so much for having me.